Good morning, everybody. Welcome to the Coronado Roundtable. I'm Christian Escoven, the president, and it's a beautiful morning, so I'm very thankful for all of you who came to this wonderful program. We have a great speaker this morning, so I'm very happy for that occasion to have with us Dr. Joseph Moore, retired Navy captain and the former CO of the hospital ship USNS Mercy, who will be our presenter this morning. But first, now that you're seated, would you please stand and join me in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Our programs are recorded live on Zoom, and for that, we'd like to thank the Coronado Public Library and its staff, especially this morning, Selena Valladolid, who's there manning the audiovisual presentation this morning. So the program will be on the library's YouTube channel within a few days. So if you have friends or acquaintances that would like to see it on the library's YouTube channel, stay tuned for that. For those of you viewing at home, please mute your computer or device, and please turn off your cameras. You may use the chat box portion function for the Q&A portion that will follow Dr. Moore's presentation. For those of you in the room, please silence your mobile phones. And please hold your questions until the Q&A portion of the program. Our coffee this morning is given by Alex of Amalo Brew. That's the coffee cart in front of the library. And we do ask for a $3 donation for the coffee that helps us provide that, as well as giving support to the library. And our program next month will be former Mayor Casey Tanaka, who will be speaking July 24th at 10 a.m. here in the library wind room on the topic of the 250th anniversary of the United States and the United States Constitution. But now to introduce our presenter, our own board member, Dan McClure. Dan?
Thank you, Christian. I'd like to introduce Dr. Joe Moore. As Christian said, he's a retired U.S. Navy captain. As the CEO of the Navy ship Mercy. Dr. Joe deployed the first Naval Pacific Partnership to Southeast Asia in 2006. He is a family medicine and sports medicine physician in this distinguished 31-year Navy career. Dr. Moore helped pioneer military sports medicine training programs and has spent decades training physicians nationally. He led the Mercy during the major humanitarian deployment following the December 2004 tsunami in Southeast Asia, coordinating large-scale medical and surgical care in a complex international setting. Dr. Moore serves as a deacon at St. Joseph's Catholic Cathedral. He and his wife, Laura, have been residents of Coronado for over 20 years, and 3 of his 4 children have graduated from Coronado High School. I now present Dr. Joe.
Good morning. Good morning. Thank you very much. It's good to see friends out there, and I even met some people from outside Coronado who happens to be a physician, who happened to went to University of Virginia as I did, who graduated a year before I did. They're from Tucson. Please welcome this couple over here, Kit and Michelle. Kit and Michelle. And so small world. So the only thing we ask here, visitors of Coronado, is keep it under your hat. Would you like to keep it, we like to keep our lifestyle here quiet. We're very fortunate. We're all very fortunate to be here. I feel blessed to be here. We found out about Coronado when I was an intern in 1982. I went down to visit a buddy here who was stationed. I was stationed at Oakland Naval Hospital, and he was here at San Diego at Balboa. Came down and what houses were $250,000 in 1982? And I came down and I said, okay, we get it. So that's how we got down here. Eventually, we moved and got here in 2004. So very thankful to be here. I want to give an overview and paint a picture of not only what we did, but how we got there. And not just what we did when we got there, but what were the strategic impacts. So I will show the mission statement and talk about the people we served. And it was so interesting to have a mindset of who these people were. Some very militaristic nations, provinces that we went into, but what we found were very beautiful, kind people, daughters and mothers and grandmothers and husbands that we found that we were able to treat. A bit about what got us there. We weren't this Pacific Partnership was not the response to the tsunami, but the tsunami is what got us there. So the Mercy deployed to the tsunami. They arrived in February of 2005, and this Pacific Partnership, which I was the CEO of the Mercy, was in 2006. And we had a strategic impact, which while we were doing it, and of course, looking backwards through a lens, the impacts that came out of that. The ship has capabilities. We went with some focused capabilities that I'll talk about. We had military staff, our own Navy. We had them from all the services, public health. We had international military, and we had NGOs. So we had a cacophony of people on that ship as we sailed across the seas. I'll talk about where we went and what we did. Next slide. This is the mission, we were proactive humanitarian. So otherwise, don't wait for the disaster. Let's move forward. Let's design a program and move forward. Medical, surgical, very important, educational. Some of the places we went, for instance, Holo, the nurse midwives in that area served somewhere of 90 islands, habitable islands, where there were pregnant gals, pregnant ladies. And our educational program to these nurse midwives was probably the most important thing we did there in the area of Holo. Civic operations, we had CBs. We had helicopters that carried cinder blocks and wood and supplies to needy areas. And that caused some controversy. Within the local host nation, because there was always a suspicion of what we were doing. And I'll talk a little about that. Isolated and underserved in South and Southeast Asia. Next slide. So I'd like to paint a picture before we start and give some context. And I don't know how much information, where each of you have been. I had been nowhere on this map before we sailed to Southeast Asia. As a kid, I knew Borneo from a movie, The Wild Man of Borneo, with Frank Morgan in a comedy, mid-1930s movie. And that was the impression that I had of Borneo, an island, okay? But really, Borneo is, but can you imagine if, the only thing you knew about Coronado was Some Like It Hot with Marilyn Monroe? If that's your only image of Coronado, it's a little misappropriate, little skewed, so, although it is like that here, no. But Borneo's 3 sovereign nations. It's got Malaysia on the west and north, and it's got the little kingdom of Brunei, very powerful and also very rich in oil, and the Indonesian portion of Borneo itself. We started the mission by sailing to Manila, okay, in the Philippines. We're in Manila, and a Mercy ship in World War II sailed into Manila, not our ship, but the USNS Mercy, the hospital ship Mercy in World War II sailed in and helped rescue take care of the survivors of the Bataan Death March and also the hospital, the Army hospital that was overrun. So the nurses that were trapped in that whole conflagration. So I had a great honor. I was able to sail the Mercy. They actually let me sail, and I said, I'd love to sail the Mercy into Manila Bay. And oh, sure, Doc, come on up. So on the bridge, I'm sailing, and I see land about 15 miles that way, and land about 20 miles that way. I'm sailing along it, and the captain goes, okay, Doc, that's enough. We got it from here. You sail close enough to dry land. That's as close as we're letting you get. But we were in Zamboanga. We started the first part of the mission in Zamboanga. And you think about Zamboanga, and that was the headquarters of Blackjack Pershing, Spanish-American War. We served a hospital that was part of the barracks, was actually part of the stables converted to the hospital in Zamboanga. And many things we did in Zamboanga. If you repair a IV pump, you can have an effective pediatric chemotherapy program in Zamboanga, but they didn't have a pediatric IV pump that worked. Just some of the impacts from something as simple as biomedical repair. We went on down. I'll talk about Holo, the autonomous Muslim Mindanao, semi-autonomous regions was very, very dangerous areas that we went into. We had 3 phases. In each phase, we went back to Singapore. So you think about this whole area of Burma in the past being controlled by the Brits. You know, Singapore is kind of the Rock of Gibraltar of Southeast Asia. We went back and geared up, offloaded personnel, brought new personnel on board. So we were in Singapore. The biggest part of what we did was in Banda Aceh, the Aceh region, the largest island of Indonesia, Sumatra, and the northern region is the Aceh region, okay? And we went back to Banda Aceh, as well as the small islands of Simeulue and Nias. Tremendous things that we were able to accomplish there. We had our only death in a town called Tarakan. Now, Tarakan is important historically because after the Japanese attacked Pearl Harbor, the next day they rained terror down on this whole area of Borneo, and specifically in the town of Tarakan. Because why? Because the Dutch had developed the oil they've got sweet crude. I'm not sure what sweet crude oil is, but they have it there, and it was important for the Japanese to advance their military causes. When we pulled into Dili, East Timor, Timor-Leste, the poorest country by definition of the United Nations, Timor-Leste, we sailed into Dili, and we come around the corner, and it's the statue of the outstretched arms of Christ, the Cristo Redondo, that you see in Rio de Janeiro, a replica of that up on a mountain, because that was Portuguese controlled at one time. Many, many things. I would just paint that picture. These waterways, we'll talk a little bit about the Straits of Malacca. You think about the Straits of Hormuz. The Straits of Malacca were much more important for tolls and the movement of commerce and the movement of civilization, the movement of education, the movement of ideas, all came through those straits. Next slide. So starting with the Silk Road, we call it the Silk Road. It was important. The Chinese, I'll mention what they did after we finished our campaign, our partnership. But this was not only the road, but the waterways, and all of them went through Indonesia, through the Straits of Malacca. Next slide. Then the ancient spice trades. So all of that into, the Spice Islands. You had pepper from India, all of this influence into Persia. Banda Aceh, Banda is a Persian word, it means port, it comes from the Persian. And the people of Banda Aceh, that whole region of Indonesia, primarily Sunni Muslims. In this area too, you think, well, what is our connection to that? Back in the day, in the 1700s, our colonists, and because of the Dutch East Indies, we were getting nutmeg and pepper and spice, for Christmas puddings and stuff in the 1770s from this spice trade. Next slide. So I'd like to bear down a little bit and give just a tad history of this area of Sumatra and Aceh. Aceh, this northern region, Malaysia, okay, the peoples are very similar, but the Acehnese are considered a different, area, a different type of living and growing up and customs. But this whole area for many, many centuries was controlled by the sultans. The most famous, and they named the airport in Banda Aceh the Sultan Iskandar Muda Airport after this sultanate. And when you look at this map, you look at the idea of what we think of as continent. The Indonesians, and especially in Aceh, think their word for continent is land and water. Land and water. So they think of this as one whole expanse. And interestingly, as you move from seas, if you move from the Celeb Sea, I saw it with my own eyes. I don't know what it was. I'm looking in the distance and I'm off the ship off the rail looking as we're moving forward. And there's this roiling of water. We're out in the middle of the ocean. We were going from the Celeb Sea into the Sulu Sea. And we come across it and we go across probably a half a mile of roiling, burbling, cascading waters. And Bob Wiley, who was the ship's captain that ran and drove the ship, I said, Bob, what is that? And he goes, you never seen a maelstrom before? That's a maelstrom. These islands or the seas aren't named just because they are in a sort of geographic area. They have very different qualities, different temperatures, different kettles of fish. So it's very fascinating how this is sort of opening our eyes as we go through this trip. The Aceh controlled much of this environment in the mid 1500s, 16th century. Next slide. Then you had Portugal come in. The Portuguese wanted to control, and they started here in Dili, which I mentioned, at about 1512, and gradually moved across into this area when they controlled Malacca, the town of Malacca in Malaysia here, New World Malaysia. They were able to maintain control of the Straits of Malacca. This strait, by the way, comes down into about a 1.5 mile radius or expanse, and that's why that's so important for shipping and so available for tolling ships for exercising a toll on everything that goes through there. So this was a very rich area in terms of monetary, also in terms of intellectual development, in terms of different cultures. All that moved with the trade, with the merchant trade. Next slide. And finally, if we look at this, how these areas were colonized, the Spanish in the Philippines, the Philippine War, the Americans colonized it for many years, the Philippines, and then you have the British Empire through Burma, Malaysia, Singapore down here, the French Empire, Vietnam, Cambodia, Laos, what they call the Second French Empire. Portuguese had all of this, and then they were with the Dutch coming through. They overpowered the Portuguese, and they were left with sort of the east portion of Timor, and that's where we had the statue of Christ when we pulled into the port. But the Dutch had a tremendous, and this gradually became the Dutch East Indies. Next slide. And at that time, Dutch East Indies down here, this area where Tarakan is Borneo. This is where the fighting occurred right after Pearl Harbor. This slide down in the corner is a development. It's a oil refinery by the Dutch. Dutch Shell Oil controlled that whole area. And of course, they were overcome by the Japanese. Next slide. So what changed all that? This area, very isolated, very hard, very impenetrable to strategic engagement, to diplomatic engagement, to relief efforts. They had no choice because they were devastated with the tsunami, and it occurred right on this tip, right at Banda Aceh, right near the island of Nias and Simeulue. And you can see those affected areas. And we did go up into Bangladesh even. Part of our trip that you'll see took us, and we did it in 3 phases, but part of our trip took us into Bangladesh. So Next slide. We responded very rapidly. The United States did a tremendous job. The USS Abraham Lincoln and Operation Unified Assistance almost deployed immediately with a carrier strike group, with aircraft, amphibious ships, helicopters, and logistics supports. I know John is out there, my helicopter driver. Yes, he can tell us a little bit about this, but these ships, these helicopters were packed with supplies, with foods, with all sorts of repair equipment, and they were really the heroes in that first week. Was the helicopters. Next slide. So you saw this. Roads and bridges and ports were destroyed. The helicopters were the only way to move things, but there was in this area suspicion. It was very militarized, still is, and by that I mean there was an ongoing conflict. The TNI, the military for the Indonesia national forces, and what was called the GAM, sort of the public people's resistance. There was conflict going on, and then you insert the gray hulls off the coast, and you bring in with helicopters, and there was a lot of friction. There was a lot of desire to control the narrative of why these people are here. But there was no doubt in people's mind, the common person, that they were being aided by Americans. Next slide. So where was Mercy? Mercy was not a first responder. Mercy happened to be in San Diego. It deployed, it was activated, and departed in February 2005, and then steamed, flank speed, 13.5 knots, all the way across, and took about a month to get there. It may be 14 knots if we crank it up. By that, the acute phase had kind of subsided. Next slide. And we actually started to develop surgical care, public health support, medical outreach, follow-on humanitarian assistance, especially around areas of Banda Aceh and Nias and Simeulue. And we have some actual public health workers that deployed on this and can talk at the break about what they saw. But what the people saw was a white ship with red crosses off the coast for the first time. So it wasn't a gray hull. This could not easily be discontinued. The narrative couldn't be controlled at this point when it came to the trying to control the public perceptions. Next slide. So with that, it was perceptions versus optics. And we kept hearing about the optics as we were going across, and we had a public affairs detachment. And it was all about the optics, Doc. We want to get a picture here and this and that, and Senate. Carriers generate the gray hull ship. Now this, I'm being very broad brushed, but I'm trying to paint a picture of what we were up against in terms of the narrative in these areas. The gray hull, we know, brings speed, lift, and logistics. But in a militaristic environment, in the school systems and otherwise, when they speak to the people, let's be careful of these people, because the Americans are arriving with weapons, as opposed to what the Mercy generated, a white ship with red crosses, doctors, nurses, and dentists, never had seen doctors, never had seen dentists, never had seen Americans to speak of, and America arrives with healing. That was our counter move. That was our counter. So, next slide. And there you have it. You have the contrast right there. I'll say a little bit about the size of the Mercy. It's about 980 feet long. A carrier is probably 12. Somebody help me out here, about 1,200 feet long. But you can see the contrast. The carrier is just slightly faster than the Mercy. Here they are in the race. Next slide. But optics mattered. So there was a lot of information that came through and filtered, and the analysts filtered it through the RAND Corporation, and the various military schools, the military war commands. But Operation Unified Assistance produced one of the largest positive shifts in public perception of the U.S. and South Asia since World War II, especially in Indonesia, where there was a dramatic improvement in the attitudes towards the United States. And a lesson learned, and again, I'm saying Operation Unified Assistance, gray hulls and the white ship with the red crosses. Humanitarian assistance can create a strategic influence faster than the traditional military operations. And our mantra was winning hearts and minds, winning hearts and minds. And that's what we heard. We were out there and we were doing our job, and we kept, the narrative kept sort of developing as we were out there. We're winning hearts and minds. Not that we go out and say that to the people, but that's what we were hearing in the background. Next slide. And how this lives. So the tsunami demonstrated several things. The hospital ship was a strategic asset. It was a diplomatic platform. It was a public diplomacy platform, security cooperation, and a relationship building platform. It was not merely a medical platform. We had our Philippine President, Gloria Macapagal Arroyo, visit us, and here she's shaking hands with a grandmother of a 13-year-old who had had surgery. This was down in Jolo, in the Badlands. And it was great. We had by design that we had many Filipino sailors aboard, and this was a great event for them. And many of the civilian mariners, quite a few were married and had their families were in the Philippines. So it was very important to them when we stopped in Manila that we had time for them to get off. And there were 69 mariners, and many got off and were able to visit their families when we first got through Manila. Luckily, we got through Manila Bay with no issues to Manila. But I'll say a word about grandmothers. Grandmothers were probably our best spokespersons. Grandmothers, they saw the bottom line, both for themselves and for their families. Grandmothers were everywhere, and they were able to crawl up and down ladders like nothing I've ever seen. It was absolutely amazing. There was a grandmother I'll never forget. Two grandmothers I won't forget. One was up in Bangladesh, I'll talk about in a little bit, but the other was a grandma who was in Kupang, and she got up out of we had a tender, a boat that would come by, or a small boat that would allow them to get to the gangway, and she'd climb up the ladder into the gangway and she came back out, and I saw her coming back out, and you say grandma, you say auntie, how are you today? Grandma, how did it go today? And she goes, oh, I'm fine. She went in for a imaging study of the breast. She had breast cancer, and the doctors told her there was nothing to be done. And she said, I said, are you okay? And she said, no, I know now. This is the best, and there's nothing more for me. I'm very happy to have found that out. And so those kinds of stories would just melt your heart. So that's the kind of things. Grandmas are key to our success, I think. Next slide. The tsunami opened these engagement doors. Local leaders who might never visit a carrier were eager to visit the Mercy. This is Cecil Lobregat. He's the mayor of Zamboanga. His grandfather was on the government constitutional Congress that was authorized by the U.S. in 1934 as we slowly allowed the Philippines into an autonomous constitution. His grandfather was on that constitutional committee. And there's a lot of that familial legacy. They call them landlord legislators or political politicians. It's that they own vast tracts of land or monies, and they basically pass not only the land and the wealth, but also the political influence down through their progeny. So Cecil was very happy to see us in Zamboanga, and we were able to, we also donated things like what are called gift in kind. So we had a ceremony where we dedicated an antique Singer sewing machine as a symbol of our relationship and our thanks and our gratitude, and as a symbol of their economy in the linen and clothing industry. So it went a long way. I had a group of politicians, I'll say, and I was walking around giving them a tour of the Mercy, and I said, how many of you would like to get a CT scan? And everybody's hand went up. And I said, no, I'm just kidding. And that wasn't just kidding. Like, I thought, what a response. Everybody wanted, they wanted whatever we had, Next slide. Presence mattered. It communicated we care, okay? And the concept then was don't wait for a disaster, build relationships, improve public health, train local providers, establish trust. And that was the nidus, that was the germ, that was the cause for Pacific Partnership. Next slide. There are many references here. One of the people I can acknowledge is Admiral Ruffhead. He was the CNO, and he was a big pusher of Pacific Partnership. These are references will be in the slide deck. Next slide. So what happens? I think imitation is a serious form of flattery. In 2008, they commissioned a plan, the People's Liberation Army and Navy hospital ship Peace Ark in 2008, and they launched their own mission in 2008 called Harmonious Mission. Next slide. And they were winning hearts and minds. China's floating hospital ship wins hearts and minds in an increasingly contested Pacific. And after the Pacific tour, it will set sail for the Dominican Republic, a nation had to switch its allegiances earlier. So they will go to places that support, acknowledge, and sign on to the One China policy and denounce Taiwan. And they'll sail by other islands that don't. So small islands like Vanuatu or Tonga, sure, we'll sign on, absolutely. So next slide. This was out, we went with the Peleliu at a different time into Papua New Guinea, and this was them sailing into Papua New Guinea, into Port Arthur, and some of the Facebook comments, "Thank you, President Xi and the great people of China. I like their staff and all energetic, slim, and diligently doing their duties. Better than USA, only USA wants is make a deal with our government." And always one in the group, lots of laugh, most patients went home without their organs. So always one in the group. Next slide. A bit about capabilities. It has, as I mentioned, it's 894 feet. It moves, it can attain a speed of 17 knots if needed, but usually 13 knots is cruising sort of deployment speed. It can hold up to 1,200 medical personnel. The biggest thing we have is a blood bank. We can do blood. You can't do a lot of surgeries that we did without blood. We can do probably half of them. It has CT scanners, radiology units. We had 12 operating rooms. They're in the deepest part of the hull, down along the keel, which is what has the least amount of motion. It has, of course, isolation wards and intensive care units. Next slide. We went with inpatient beds, 163, and casualty receiving. A lot of what we did was we had an outreach program. We evaluated people that needed surgery. We flew them back, medevac them on the helicopters. They went into casualty receiving, and that's how we generated the surgeries that we had. 4 of 12 operating rooms were operational. Next slide. Water production from the Mercy, ice production, oxygen production, laundry services, the civilian mariners and their engineering services, along with the CBs. Next slide. Dental labs, physical therapy, nutrition care, lots of glasses. I think 13,000 glasses we developed. Next slide. But it couldn't be done without this. In 2005, there was not a helicopter asset on the Mercy. Before we sailed, this is the hangar deck for the MH-60 Sierra Seahawk helicopter. And these things were workhorses. They brought patients, they brought litters, they brought, as I mentioned, cinder blocks. They brought wood. They moved everything, and they got shot at. There was in the empennage. There was a shot near the tail of one of the tail rotors when we were in Holo. This is a gal in Dili I'll talk about. She saved her life. She had a ectopic pregnancy. Came to the clinic. We were just about ready to sail, and we got her back. She had a belly full of blood, and they stopped the bleeding and tied off her fallopian tubes, and she survived. She was 16. Her mom would work for the embassy, and host national, worked for the embassy. Impossible. My daughter has never had sex, and this is what we were able to do. Next slide. So we had U.S. military, international military, non-government organizations. Next slide. All of Navy, Air Force, Military Sea Lift Command, Army, Marine Corps, Public Health Services as part of our U.S. military contingent. Next slide. And we had members of the Philippines, India, Singapore, Australia, and some more than others. The Australians gave us 9 doctors and surgeons. The Philippines gave us 2, but a lot of dentists. The Bangladeshis, no surgeons, but a lot of nurses. Indonesia, a lot of techs, Canada, dentists, and we had veterinary support in Malaysia. Next slide. We had all of these NGOs, and this was like Noah's Ark. It was a cacophony of people coming around. Many of these people were not enthralled with the military. They were anti-military. U.S. citizens that were anti-military to us, but I think we grew on them, and they grew on us. Next slide. We had three deployments coming into Manila. We did Zamboanga, Holo, and Tawi-Tawi, and then back to Singapore, and then from up into our second deployment up into Chittagong, Simeulue, and Nias, those islands, and then Tarakan, and also Bangladesh, Banda Aceh, and then Tarakan and Kupang and Timor was our last one. Next slide. These were the dates. We were so early, late May. We got there early May, late May. We were rolling into Zamboanga, Holo. Next slide. This area, that's the town of Zamboanga City. That's where Blackjack Pershing, that's where we did many biomedical repairs. And in the Philippines, we pulled a ton of teeth. We pulled, in every child, it seemed, came from all over, and we pulled teeth. And those children, I'll guarantee you, they did not make a sound. And we were numbing them up and pulling them, numbing them up and pulling them. And I even got into the act, and I never pulled a tooth before. And these kids did not make a sound. And, it was amazing. Next slide. Cecil Obregat, the antique, this winning hearts and minds, so this soft power concept, it really paid off. We didn't know what we were doing and why we were doing this, but it happened. Next slide. This slide's a little bit, in Zamboanga, but autonomous Muslim Mindanao is this area in Holo and Tawi-Tawi down. Beautiful islands. There would be, if this were a democratic society, beautiful hotels, resort, luxury, the most beautiful beaches you ever saw. But life was so cheap when we were there that you couldn't go unaccompanied. Someone would hit you in the head, throw you in the back of a car, and take you to the at that time they were the Abu Sayyaf for a bag of rice. Now it wasn't that was a dad who needed to feed us. He wasn't antagonistic to us. You were just an ability to eat. Next slide. This was that area where we had this is the sanitarium. It was actually the training grounds for the nurse midwives. Did a lot of training here. Next slide. Training the host nations. Lots of back school, OBGYN, neonatal, BLS, nutrition. Next slide. Casualty receiving tons of x-rays, labs, and CT scans, getting people ready for or making the diagnostic scans as well as post-op, pre-op scans. Next slide. PACUs, we had some very, very sick people. We had to triangulate the helicopter. We'd have to leave Nias and with a patient on board that had surgery. We'd sail at some point the helicopter would evacuate him back to Nias, and then had to catch up with the ship as it moved forward. Next slide. Tons of radiology and imaging studies. Everywhere we went, we were the highest medical componentry any nation had seen, any of these provinces had seen. Next slide. Top surgically, cleft lip, lots of cleft lip, cleft palate in older children. A lot of these will be staged and done earlier. This children, this gal here was about 8. She's about 28 years old now. Beautiful people, but they were maligned and bullied if they had these deformities. Next slide. Lots of herniaries, deformities. I had one case I was mentioning to Fern, who's a dermatologist. 16-year-old with a lesion on the side. She had, to fast forward it, her twin in utero had died and the tissue had adhered, the embryonic tissue had adhered to the side of her. And at age 16, she had a mass on her side that had componentry of hair, teeth, and a urinary system that leaked every day. And we were able to zip that off. That would have been done on day 2 or 3 in the ICU here in the United States or elsewhere. Next slide. Lots of these, tons of orders, things that you hadn't seen in textbooks and you don't see. Hadn't seen them before, hadn't seen them since. Tremendous stage procedures like this. Next slide. Tons of biomedical repairs. These are things that really help people in the long term. Systems brought up to capacity, x-ray machines, ultrasounds, EKGs, tons and tons of equipment that help. You can't run a hospital if your equipment breaks down. Next slide. And this was all through the services, all through the deployments. Dental extractions, closing in on 10,000 teeth. Now, when we did Papua New Guinea, we had 0 teeth because they used a betel nut and protects the gums, turns the teeth black, but they have no dental problems. Next slide. Bangladesh and Chittagong, I mentioned. Simalu, Banda Aceh. Next slide. We got into Chittagong, and actually as the port town, but we had to down here, it's called Cox's Bazar, and in this area, and you're given notices, you're given NOTAMs, don't fly Garuda. Garuda's a national airline. No, unsafe, don't fly Garuda. Well, we got there around the 4th of July, and they wanted a toll, they wanted to charge us. And the Commodore's like, I'm not paying a toll. So he sent a delegation, I was one of them, to go to Dhaka, and the embassy was closed over the weekend, but we flew to Dhaka. Why? How are we getting there? Well, we flew Garuda, so typical. Okay, we did get in. Next slide. Tumors, hysterectomies, botched hysterectomies that some places pay the patient has to pay by the stitch, and so we saw some botched hysterectomies, women that were close to death. Next slide. What I saw, grandmother haunted me in Bangladesh. She carried their baby, this baby around with a flappy ankle, and everywhere I see her, I came out of a meeting, there she is holding the baby. And finally I went to the plastics. I said, can we do anything for this child? This lady is haunting me. And he said, Skipper, it's about a 7-stage procedure. It's good, but weeks and months. We'd have to take her back. And we didn't have the capability. I understand we might do that now, to take her back to CONUS and get these done. But these were caused by these kerosene lamps. They read by kerosene lamps at night. They spill, they get scalded, and they have what are called flexion contractures. So they're deformed for the remainder of their life. They can't move, not because of the bone and ankle joint, but because of the skin. Next slide. Skin in. So here we are in Banda Aceh, these islands of Simalu. Okay, and then back, next slide. This was Banda Aceh. And now, if you go to Banda Aceh, there is a tourist, it's called disaster tourism is the term. This ship was sent 5 miles inland in a rice paddy. They made a little museum out of it. This ship, when we got there, was still there. You can see the devastation. It doesn't do homage. These mountains were scoured. The water came in 2 ways and scoured the topsoil off the mountains to midway up to the mid portion of these mountains right here. It's just an incredible thing. And this was almost 1.5 years after, just denuded. Next slide. Lots of immunization, disease prevention. Next slide. Deworming, lots of worms, lots of parasites, tons of glasses, optometry visits. Next slide. And surgeries, tons and tons of cataracts. They don't have eye protection. We wear sunglasses, that helps. Next slide. These Seabees, they did tremendous things. They reworked a hospital wing in Tawi, installed water pumps in Banda Aceh, which after we left, they tore them out. They said they were trying to poison the water system, So these kinds of things. Ceiling fans in Chittagong, Tarakan, hospital, air conditioning. In Bangladesh, the windows were open in the operating room. Flies, and you're operating, and you just have to have good as a patient. You just have to be healthy to get through that. But surgeons are tremendously trained, well-trained, great diagnosticians because they don't have CTs and MRIs. They're tremendous at examining the patient and getting an idea of the diagnosis. Next slide. Tarakan, next slide. This is the last. Went into Tarakan. I mentioned we had a death. A lady had a tumor. We instituted a walking blood bank, which means every sailor, civilian on the ship who matched the blood type came down. We gave this woman 260 blood products, platelets, whole blood, fresh frozen plasma, we call it, but we're walking blood bank. And while we're in Tarakan, we were onboarded by the Indonesian. Some nurses, some were trainers, some were facilitators. Some said I'm a navigator, some said I was this. So we brought them on, put them in different places. The more cynical Commodore said, they're spies, you know. I'm like, and I'll tell you, I went to the office of the provincial governor, and many of the politicians rise up through the medical system. They don't rise up through law, through the schools of law as we do here. So he was a physician, and right before we were in an anteroom, and I got a call. It said, "Skipper, we lost her. She passed away. I'm so sorry to tell you." Well, my phone went off. 5 other phones in that room went off, and they were getting the same message I got. So they knew exactly what was going on. They were watching us very, very closely. I went in, we sat down. I said, I thought, boy, this is the end of the mission. International, whatever. And he goes, I said, sir, I'm very sorry. He goes, stop. He said, we gave you the toughest cases, and death is a part of life. And you did as best as you could. And that was it. We walked out, and that was just a lesson learned. Life is very cheap in that area. Next slide. Lots of general surgeries. I'll just say one. This is Rose. She had a 40-pound uterine tumor, benign tumor, but grew for many years. She was 34 years old. She had a 2-year-old child, and she had this tumor that was pressing on her esophagus. She couldn't swallow. She could only do sips. So every time they tried to do surgery, they lay her down and it'd drop against the vena cava and cause her to go hypotensive. And so what the surgeons did was they did a quick induction. They put her out sitting up. They opened the cavity. They grabbed the tumor, and then they laid her down, and this surgeon held that tumor while everybody dissected it around it and took it out. 40 pounds later, she went from 104 to 66 pounds in about 3 hours. Next slide. This is Rose. I love her. She said, Rose, let me see yours. She pulls up. She had the scar, looked like a zipper. She was the most beautiful gal you ever saw. Just loved her. Next slide. Peds, lots of peds. Cleft lip primarily, hernias, tumor excisions, lots of tumors we talked about. Next slide. Blood products, I mentioned that episode of the walking blood bank, but you can't do this on an amphibious ship. You can't do this on a gray hull. You can do a lot of things, but we just don't have the capabilities or the architecture and the infrastructure. Next slide. Lots of pediatrics. Next slide. Cardiac endocrinology, lots of cardiac echo, okay? Lots of valvular disease. Many orthopedic cases. Next slide. Public health services, can't say enough about public health and all they did, just tremendously looking at water sources, testing waters, immunizations, all of that, training. Next slide. Veterinary encounters. Anytime you're at Katrina, nobody wants to lose their dog. You have to set up a veterinary center. Next, we had a veterinary center next to the ship. The Iwo Jima was there. And so the dogs were an important part of disaster relief. Lots of prescriptions. Next slide. On into Dili. Next slide. This is Kupang and Dili. This is West Timor, Timor-Leste. What I remember next slide. What I remember in Kupang was a cargo ship, a small cargo ship with a bunch of birds in bird cages hanging out. They were airing out the birds that they had poached, from these beautiful rainforests, and they were going on to wherever they were taking them. This is a recent thing, just last March, this was posted. Indonesian boat stopped with cockatoos stuffed in thermoses. It was this bird industry, they're slowly being extracted, pirated out of there. That's what I remember about Kupang. Next slide. This was Dili, the Cristo Redondo. This is the gal who we saved her life. Next slide. That's the Mercy, by the way, off the coast. A lot of times the Mercy couldn't pull into a port, so we had a tender. At one point, I was in Holo, and there was in the Badlands, and we were on the side of the pier, and suddenly a SEAL team showed up. Little did we know we had the Mustang, which was a destroyer, and the SEAL team was kind of following us all along, I'm just a doctor. What would I know? Total patients encounters. Many patients we had multiple encounters. These are the total 60,000 patients seen, 214,000 encounters. So they may come in, they may get an immunization, they may get medication, they may get eyeglasses, they may have a tooth pulled. So this is the scene rate. On average, they had 3.9 appointments as time went on average. Next slide. I think we're about there. Next slide. I'll stop it there and questions. It went from, oh, very good. Yeah.
We take questions one at a time, and for recording purposes, we need to have the mic given to you. If you have a question, so please raise your hand, and we will have the mic given to you one at a time. So please hold your question. Just a minute until we get to oh, thank you.
Ready? Next step. Okay.
Taking a break
So,
now?
yeah.
Oh, are we taking a break?
Oh, do you want a break or do you want to just go forward?
Roll into the questions.
Okay.
So,
All Thanks, Captain. How long was the mission?
so the mission, we got into, we went straight to Manila in early May, did deployment through Manila back into Singapore, and we pulled out of Dili in September, May, June, July, August, September, 4 months. And there was the last part was into Darwin. There was an emergency. They had a lot of beer on hand, and we had to help drink the beer. We consider that part of our mission as well.
Okay, next question is right here. Go ahead and stand up, dude.
Great briefing, Captain. Thank you very much.
Thank you.
My question is the Mercy a one-of-a-kind ship, or are there others in that category?
Very good point. And we have the former chief of Surf Pack who controlled those ships. Not quite. The ships go up through what's called MSC, Military Sea Lift Command, which has its own sort of chain of command up. It goes and actually reports up into Navy eventually. But there are two. There's Comfort that's stationed in Baltimore, and the sister ship Comfort, and the type ship is the Mercy ship, and it's here in San Diego. So there are two ships. Thank you.
Okay, Fern, you have the next question.
Yeah, can you just bring us up to date a little bit on what's going on with the Mercy ships now and what areas they're covering? And
Yeah.
how is it decided what area needs our Mercy ships the most?
The last part I'll answer. How is it decided where they go? I'm not quite privy to that, and that happens at higher headquarters, and I think there are military planners and briefers that see where we should go next, where we want to go, and that sometimes the Mercy will, like with this thing with Venezuela, I think probably the Comfort will be deployed. They had planned to go. It's going to be distracted and go down to Venezuela. But the other places that we've gone, to Vietnam, we've gone to Cambodia, gone to Papua New Guinea, gone to all of these other places in Indonesia. And now I understand, talk with the Mercy, is this primarily just U.S. Armed Services. And I don't know why that is, except to say that we're in such a social media environment that if you have civilians on there with you can't prevent them from making their own, sort of news feed. And I think that's one of the reasons why it's just now, over the last several missions, has just been U.S. military, primarily Navy alone.
Okay, next question, Dr. Phillips.
Dr. Phillips.
You sort of answered it. I was just wondering, how do you recruit and screen the staff? Docs and nurses are generally busy.
Generally, yes. But generally, you have, as a physician at that time, and I think still to this day, you have two billets. You're billeted at the hospital, so you're a dermatologist at the hospital. You have a billet on the Mercy. So we already have the billet. We know the TO. We know we know the personnel numbers. We know who they are by name. And when they get activated, they call the hospital and say, "Get them over here. Nurse Fern, you're on dermatology. You're going." And it's the same with sailors, and also supply corps and other ancillary corps, dentists, of course, and all the techs that go with them. Everybody's got a secondary billet that they're a deployment billet.
Okay, next question, stand up. Mike is handing the mic to Mike.
Hi, Mike.
Thank you. It was a wonderful talk.
Thank you.
And you had quite a few of your operations in the central Indonesia and the Philippines. And I understand the area that got the brunt of the tsunami was the Aceh, Banda Aceh and
Banda.
the west. So, and Bangladesh, I imagine too. So can you explain how the decisions were made about where to provide the treatment?
Primarily, absolutely. The question is what we're looking at in terms of how we instituted the Philippines, because it was on the way. I think that's probably come from Guam, come down across, and the Philippines are further north, sort of on the latitude of Guam. So we came in through that way, and we did our deployments through the Philippines, and then into those lower areas. But yes, our primary mission, where the Mercy went in at the disaster after the tsunami, was Nias, Simeulue, and Banda Aceh. The Aceh is that northern portion of Sumatra, and that was our primary area of focus. We probably exerted most of our care there, most of our supplies there. The other areas were for goodwill, but very much needed. But yes.
The next question is from World Cup Frank.
Oh, Paraguay.
Anyway, I wanted to find out how old is that ship and how far in the future does it go? And the one on the sister ship on the East Coast.
Do you want to? So we have the person who is a subject expert on that. That ship I could probably tell you, but right here, Steve, Admiral Cleary knows.
Yeah, my name's Steve Clary. I worked at National Steel and Shipbuilding Company after 30 years in the Navy. The Mercy and the Comfort were originally oil tankers to carry crude oil from the Alaskan pipeline out of Valdez, famous, of course, for the Exxon Valdez, to the refineries up and down the coast. And at the height of sort of the Cold War, President Carter and the military were concerned that the Soviets might be coming down through Iran to get a warm water access in the Persian Gulf. So they decided to commission 2 hospital ships, and they were oil tankers built originally in 1974. So you know how old they are. And it took 3 years to convert them, about $200 million a piece. They were oil tankers and with the big crude oil tanks in them. They're old by technology in terms of ship's propulsion. They're steam powered, if you believe that. And the company hired hospital consultants, and it's really interesting because a lot of hospitals are vertical in the flow of patients. And here, if you look at the ship, you can see everything flows horizontally.
Mm-hmm.
The helicopter comes in, triage, operating rooms, etc. Mm-hmm. Anyway, great ships, but very, very old.
Yeah. I'll say absolutely. Thank you, Admiral. Much of the, if you can imagine a general hospital, take it and turn it upside down. The emergency room is kind of on the top of the ship, and the only exception is the ORs are down below, along the keel, as low as you can get. So, absolutely.
Okay, next question, Rick.
You mentioned that not all the ORs were used. Why not?
Well, first of all, it was staffing. We had a set number of staff, and you can run a lot of surgeries through 12 ORs, but you also have to have a lot of ancillary staff. You have to have a lot of supplies, you have to have fixed equipment, and sterility and follow on and cleaning. And so it was more efficient to put everybody and get them down into 4 ORs and have them move efficiently through 4 ORs than to have it spread out through 12.
Next question,
Thank
Jean.
you. Good question.
Yes, I was wondering if you ran into any cultural or religious problems dealing with your patients between Muslims, and specifically because I know in Malaysia in the past, there have been prohibitions against male physicians treating females, and also if there was a reaction against female staff on the ship.
That's a very good question, and I'll give 2 examples. Yes, in some areas, we were very careful to have female staff lined up with female patients and female support groups. Now, the other thing was sometimes you had to have, because of the male influence, that female staff, although she was perfectly competent, there needed to be a male staff sort of behind the curtain so that she could talk to. The perception was she was getting guidance from the male. And so that's one thing we had to do in certain parts, not as much because it's that people were so destitute that some of that was bypassed. None of that in the Philippines. We had a death, and we went and we actually, it would have been very insulting just to turn the body over. We actually took that body, put it in got it off the ship, got it into an ambulance, and the nurses, and we were all dressed in whites, and nurses boarded the ambulance. We went through the Terracon, the town, and we got deeper and deeper into more and more a work environment and apartment complexes. We came in around the corner, and there was a crowd waiting for us. And when they opened up the ambulance door, we thought, oh my gosh, they're going to, what are they going to do? They took the body out, put it on their shoulders, and they started the procession to the parents' house. And we all just got in behind them and walked, and we were walking, and people were looking at us from these wooden, two-story apartments, looking down on us. And we're on a boardwalk, and we went up to the second-story apartment of the mom and dad, and they laid her out and had a Persian rug, sort of, like I call it that, and laid the body. Was draped in a white cloth, covered in a cloth, draped the body, and the nurses, we all cried. We all cried. But it was important to say that God had another mission for her, and that was enough. She was 34. She left 2 kids, and of course, at any wake, everybody's sad. But it was very satisfying. We got a call from 7th Fleet. It was like, what did you do with the body? And they were all happy with what had transpired. So, yeah, thank you.
Thank you very much. Excellent presentation, Dr. Moore. Excellent. And thank you all for coming. July 24th, we'll have Casey Tanaka, so we'd love to see you back here in the wind room. Thank you all for coming again. Thank you, Dr. Moore.
Thank you, sir. Thank you. Thank you, Chris.